Welcome back to Inside. I'm here at Indiana Physical Therapy with Josh Butcher. We're talking about the TPI. Tell me what it is and how you use it here at IPT.
Yeah, TPI, it stands for Titleist Performance Institute. They designed a screen for golfers. So it's a functional movement screen, meaning I will take a client through a series of tests looking at how do you turn your head, how do you turn your trunk, how strong are your glutes, how do you perform a hip hinge. It's all sorts of different movements that are related to golf, and we can look at some common flaws and see how that might be affecting your swing so that we can prescribe you exercises or do some kind of hands-on treatment to get you moving better to improve your golf swing.
So it not only can improve how you play, but it's going to keep you from getting hurt.
Correct.
When you're playing.
Yeah, it can work both ways. So some people I will see are coming back from injury, so we use it to see can they perform those movements in a healthy manner without pain, full motion, or it can be someone that just wants to improve their performance, and so we find some ways through that test that we can help them out to improve their efficiency of their golf swing.
So how do I do this? Do I just call you to get time on the TPI screen?
You call in and ask for the Titleist screen, and they'll know where to send you. And then we do an evaluation period where we go through all the tests, and then I'll prescribe some exercise or treatment. And then the follow-up visits is basically just we're going through a workout. We find those issues you have in the screen, and then we find ways to work on them through exercise or hands-on treatment.
And how long is this process? I mean, is it something that people do during the season? Is it something people do in the off season? How's it work?
Both. So I've had people in the off season come in, gearing up for the next season, trying to fix their swing, or someone that's battling an injury during the season and is just trying to get back on the course without pain.
And is it something I can do when I'm in pain? Is it something?
Absolutely. Yeah, we can use pain to guide our decision making. So. And that's the thing that's confusing to some people. Is it golf rehab? Is it golf fitness? Well, it can be a little bit of both. It can work both ways.
That's super important. So let's talk about something else that you do here at Indiana Physical Therapy. You help people who have been injured get back to sports. So how do you do that? How do you help, or how does somebody know if after they've been injured that they can return to the sport that they love, whether it's golf or something else?
Right, yeah. They need to be in with a physical therapist that knows how to do return to sport testing. We can't just look at range of motion and strength and say you're good to go. We have a series of tests that we've identified that the evidence would support are the best tests to determine if someone is safe to return. So we have things like a functional movement screen, a wide balance test. We have a whole series of tests and software that we'll put it into to see how do you compare against an average 17-year-old soccer player. I mean, it goes down to sport and age and what is identified as normal.
That's super important for parents who want to make sure their child is safe to go back. And it's important for those of us who are older and want to make sure that we don't get hurt again if we want to run again or play that pickup basketball game. So you have this this is fun tool.
This is called the wide balance test. So this is one of the major tests that we use for both upper and lower extremity injuries.
How's this sucker work?
So if say you had a knee or a hip injury and a healthy side to compare to, this test is perfect because we're gonna look at if you push this out with your left foot and just kind of come down to a squat, and we're looking at range of motion, we're looking at strength, stability, everything all in one, and we do it in different planes of movement, and then we can look at that healthy side and compare to. So they've identified through a lot of testing that 4 to 6 centimeters difference is what we need to keep you inside. Otherwise, you're at an increased risk for injury.
I'm just trying not to fall on TV.
You're doing a
Let's
good
be
job.
honest.
You're doing a good
Yes.
job.
Well, I didn't fall. So if somebody wants to return to sports testing or the TPI, all they have to do is call you, right?
Absolutely.
All right. Give them a call. There's that central scheduling number 209-2464, or go to indianapt.com. We'll be right back.